Welcome back. 2025. A new beginning for all. But what about those who left us behind in the past year? Or I may say, we left them behind in the previous year. In all the stories, posts, we grieved about it. It wasn't even a matter of a few days or at max weeks where we talked about the victims of sexual assault in the society we are an inseparable part of. Today, the situations have not changed for good, but even for the worse. We held banners and posters about the victims and against the justice system of our country, asking for justice. And where do we have it? Nowhere. The principal of RG Kar Medical Institute is going off freely with no actual pressure or question by the justice system. Many women are out there feared by the shocking incidents which took place out there in the society. Again, where we live. The society we are a part of, and we are not able to change a damn thing. Ladies and gentlemen, today we address an issue that strikes at the heart of our healthcare system. A system meant to heal and save, now grappling with fear, violence, and mistrust. Across India, healthcare professionals are under surge, facing verbal abuse, physical assaults, and even death while on duty. The grim reality of violence in healthcare. Let me take you through the two recent incidents that encapsulate this grim reality. In Kolkata, a postgraduate medical student was on a night duty at a hospital. She never returned home. She was sexually assaulted and brutally murdered, a horrifying crime that shocked the nation. Simultaneously, in Chennai, a grieving relative of a blood cancer patient stabbed a medical oncologist, blaming the doctor for the adverse effects of treatment. These are not isolated events. Over the past 3 years, India has seen more than 200 officially reported cases of violence against doctors. Many more go unreported. Healthcare professionals, those who dedicate their lives to save others, are working under constant threat. Is this what we as a society are providing them with? Laws exist in over 20 states to protect doctors, but their implementation is lackluster. Conviction rates are alarmingly low due to legal loopholes. Cases drag on in courts, leaving victims disillusioned and perpetrators give courage. The inefficiency of our judiciary highlights a concerning disconnect from the ground realities faced by the health workers. Apathy in law enforcement and civil authorities. Our police forces and civil authorities fare no better. Many incidents are ignored, and even when reported, action is slow and often ineffective. There's a lack of training and sensitivity in handling these cases. The government's role, too, is questionable. Public healthcare remains underfunded, understaffed, and overstretched. This leaves patients frustrated, creating a pressure cooker environment where tempers, fears, and violence erupts. Doctors, unfortunately, become the targets of this misplaced anger. The roots of the problem. This problem runs deeper than any one institution. Public distrust in doctors has grown over the years. Miscommunication and sensational media coverage have eroded the doctor patient relationship, which was once a cornerstone of trust and empathy. Adding to the tension is crippling cost of healthcare in India. With low insurance penetration and high out-pocket expenses, many families face financial ruin over medical bills. When outcomes are not favorable, doctors unfairly shoulder the blame. The legal classification of doctors as service providers under the Consumer Protection Act has further commodified healthcare, reducing the doctor patient bond to a transactional relationship, breaking the cycle of violence. The question is, how do we stop this cycle from violence? The solution lies in comprehensive reform. First, we need a robust central law to protect healthcare professionals. This law must be backed by swift and effective judicial action to deter further violence. Secondly, our healthcare infrastructure needs urgent attention. Adequate funding, better staffing, and improved facilities that can elevate public frustrations. Law enforcement agencies must be trained to handle such cases with sensitivity and efficiency. Rebuilding trust is crucial. Doctors must communicate openly and empathetically with patients. Transparency in treatment and care can go a long way in mending the broken doctor patient relationship. The media also has a role to play, since nationalization should give way to responsible reporting that fosters understanding rather than division. A call to action. Ladies and gentlemen, this is not just a problem for doctors or healthcare sector. It is a societal crisis. The safety of our healthcare professionals is a reflection of our values as a nation. We owe it to the people who save our life to ensure their safety. We owe it to ourselves to restore trust in the system. Let us demand action from our judiciary, our government, and our forces, even ourselves, to create a healthy environment where doctors can do what they were meant to do: save lives, not fear for their own. In the conclusion, I would like to conclude the road ahead is not easy, but it is necessary. Together, we can break this cycle of violence and rebuild a system rooted in trust, empathy, and safety for doctors, for patients, and for all of us. Also, in the end, I would like to ask you all to not let go of the culprits easily and demand for harsher punishments. In the end, this was all a reminder and maybe some fuel to the burning fires against these heinous crimes, neglecting humanitarian grounds and especially human dignity. Thank you. Signing off, this is Lakshay from Nyakranti.